Good evening. My name is Takithia Fennell, and today I'll be discussing the moral right to health care. I want to start by first discussing the healthcare in North America, which may be a complex and kind of difficult topic given the current state of our healthcare today. Ethics is a huge part in our healthcare, and with healthcare in America, it seems more revenue based than patient based. Our wants, our needs. Um, but ethics are what guide us in decision making. It's the respect for others' beliefs. Um, it is what holds us together as a nation. Do you care or believe what this person believes? Does that affect you? How you feel about that? Things like that, which is very important in healthcare. Uh, the ACA, or the Affordable Care Act, is a comprehensive healthcare reform plan that was signed in March 2010. This law had three primary goals: make affordable healthcare insurance available to more people, expand the Medicaid program, and to support innovative medical care delivery methods. Elements of ethics in healthcare. There are many elements of ethics in healthcare. My facility has the moral right to provide healthcare to patients in need and to enforce these patients' rights while protecting them and making ethical decisions. This presentation will touch on the following: informed consent, patient rights, and medical malpractice. Informed consent is a fundamental principle in healthcare. This is the act of a patient and healthcare professional engaging in dialogue to discuss the medical treatments in depth, what the procedure entails, risks, if any, consequences, side effects, time, benefits, alternatives, etc. It would not be ethical for a healthcare professional to skip the informed consent phase. A patient has the right to know all the ins and outs of a procedure or of the medication that they'll be provided, etc. A patient has to be presented with documentation to sign that gives the physician the right to treat him or her. The documentation should explain the procedures in detail from start to finish. This documentation is also a tool that confirms that the patient is competent and can make his or her own decisions. Patient rights. This topic is more than just the right to have insurance. This topic touches more on the ethical level, probably more so than others. To name a few, patients' rights are the right to access your records and also the right for said records to be kept private and protected, the right to have patient consent, the right for fair treatment, the right to refuse care or treatment, and the right to die, euthanasia or physician-assisted suicide. Patients' rights, the right to die. There are two types of ways that a patient may decide to die in a medical setting. For medical reasons, of course: euthanasia, or PAS, or physician-assisted suicide. This is a very ethically divided topic, as a doctor's sole promise is to do no harm. Euthanasia is the act of deliberately ending a person's life to relieve suffering, lethal injection. Physician-assisted suicide is when a doctor or medical professional supplies the patient with the drugs to end his or her life, but does not actively make them take it. The patient ensues the act of the medication or taking the medication. Medical malpractice. Medical malpractice is one of the most feared circumstances as a healthcare provider, whether it resulted from negligence or omission. To be considered malpractice under the law, certain claims must follow. And those claims are a violation of the standard care procedures. This has to be consented with the medical records. If it is proven that the standard treatments weren't met, then negligence can be claimed. An injury was caused by the negligence. Patient must prove that the injury was sustained from the negligent act, or the injury resulted in significant damages. To pursue with a medical malpractice claim, the patient must show that the injury resulted in disability, loss of income, unusual pain and suffering or hardship, or significant past and future medical bills. Conclusion and mission statement. To say that a medical facility is perfect will be lying in every means of the word. It truly takes hard work and dedication to meet the ethical standards that we all base our lives on because we're all different. This medical facility will put its patients' health care and rights above all else. We will treat each patient with respect and loyalty and swear to protect their individual rights to health care. We will provide our services and adhere to those bioethical standards set before us as medical professionals. Thank you so much for watching.